So how do you manage a patient with what are the causes of high anion gap metabolic acidosis? For example, methanol. For example, diabetic ketoacidosis, right? So you must know how to manage these according to the objective, right? Now, enabling objectives. Given a patient with acid-base abnormality, the candidate will, through efficient and focused data gathering, diagnose the cause of acidemia or alkalemia expeditiously. And that is where we are going to focus today. Through efficient and focused data gathering. Okay, so what is the pH saying? What is the HCO3 saying? What's the CO2 saying? And based on this information, what is my diagnosis? This is exactly what we are doing today. Okay, so listen, interpret critical, clinical, and laboratory findings that are key in the processes of exclusion, differentiation, and diagnosis, including those derived from an accurate arterial blood gas analysis and complementary investigations for acidemia or alkalemia aimed at identifying the primary abnormality and adequacy of associated secondary compensation. Don't deal with it. So listen, interpret critical, clinical, and laboratory findings that are key in the processes of exclusion, differentiation, and diagnosis, and including those derived from an accurate arterial blood gas analysis and complementary investigations for acidemia or alkalemia aimed at identifying the primary abnormality and adequacy of associated secondary compensation, and construct an effective initial management plan for acidemia or alkalemia. So if you have a patient who develops acidosis, you must know how to manage the patient. If you have a patient who develops alkalosis, you must know how to manage the patient. Okay, describing general supportive measures, describing management of specific acid-base disorders. So that's what I was saying. For example, a patient with aspirin toxicity. Aspirin toxicity has a unique way it presents. Know how to manage it. A patient with methanol overdose, according to the medical council, you must know how to manage it. A patient with diabetic ketoacidosis, according to the Medical Council of Canada, you must know how to manage it. Right? So somebody comes, Dr. Bonnie, what are the high yield topics I need to know? I go to the objectives. Everything is there. And if so far as you are following the objectives, you realize that you are nailing bam, 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 bam. Okay? And then determining whether the patient needs to be referred for consultation.